Oh my, new treatment is round the corner again. We had Trump drug with us called Regeneron, approved by Government of India for emergency use in COVID-19. I, Dr. Bharat Jagasi, is going to talk to Professor Jean-Louis Vincent about the utility of this drug. Professor Jean-Louis Vincent is Professor of Intensive Care Medicine at the University of Brussels, Belgium. He is Editor-in-Chief of Critical Care, Current Opinion in Critical Care and ICU Management and Practice. He is past President of the World Federation of Societies of Intensive and Critical Care Medicine and past President of European Society of Intensive Care Medicine. Professor Vincent, welcome to podcast ISCCM.
Hello to everybody. I am with you in these difficult times. I hope it will get better soon.
Professor, my question to you is this new drug Regeneron has got an emergency approval in India. So when we should be using this? Any experience with this?
Well, there are several monoclonal antibodies, and Regeneron is one of them, but indeed it was developed relatively early, and it's the antibody that Donald Trump received when he was hospitalized in the US. So these antibodies are really very effective, but in the early stages of the disease, so in the stage of viral replication. So these therapies should be reserved to patients who just arrive in the hospital or maybe about to go to the hospital. In the early cases, and there is no place for Regeneron in the intensive care unit when the situation is already very severe with this inadequate host response. So for intensive care doctors, this is not indicated. The cost is quite high, more than $1,000, and that's the reason why we also reserve it to patients having a relatively high risk to develop the severe form of the disease. Those patients who are immunosuppressed, who underwent an organ transplant, etc., these are the patients who could potentially receive the monoclonal antibody relatively early, i.e. when they just arrived in the hospital, but not in the ICU. Maybe in the ICU, it's worse rather than better. It may actually have a little bit of a deleterious effect. So no, don't use it in critical aid patients.
So what I understood is for the first phase of the disease, and when patient comes to the ICU, it is already into the second phase of the disease. So it should be used in the first phase, that is
Correct.
Viral replication. And once the patient is landed into the ICU, that is second phase, it's more of a harm rather than a benefit.
Correct. Yeah.
Thanks, Professor Vincent. Thanks for joining me. It was lovely talking to you. Truly appreciate it.
It's a pleasure. My best wishes to you and all my Indian colleagues. I hope it will get better soon.
Thanks a lot, sir. Thank you. Thanks very much for doing this.
Thank you. Bye-bye.
Bye.
That's all for today. ISCCM podcast is production of Indian Society of Critical Care Medicine. Thanks for listening. Stay safe. See you again.